Restraints. Sometimes we might have to restrain a patient in healthcare. These are soft restraints. This part of the restraints gets connected to the bed or the patient's stretcher, the patient's wheelchair. These are soft restraints. Soft restraints are used on patients who are pretty much like confused. This is not the restraints that you'll actually use on a mentally ill patient. As you can see, this restraint is actually made out of Velcro. You'll wrap this part around the patient's arms, the legs. As you can see, that we're applying the restraints to the patient's arms, my arms. But yes, so the restraints is actually being applied to my arms. This end right here, like I said, will get connected to the bed. It's extremely important when you come and practice your skills, that you know how to use all these restraints, whatever skills that is that you need to learn, and because obviously it's all in the videos. So as you can see, the restraint is used, soft restraints is used to pretty much prevent someone who might be confused or elderly. Like I said, this is not restraints that you'll use on a mentally ill patient. Someone who's mentally ill, you'll go ahead and use restraints that pretty much, which is hard letter ends used by the key. So you want to use your restraints just like this. Make sure this end is connected to the chair, the bed, as you can see. And of course, when the patient's in restraint, you want to make sure that you never leave the patient. You should be watching them every 4 to 5 minutes. You'll have a log sheet, just making sure that the patient is still alive and safe, making sure that the patient is not removing their restraints. All right, so like I said, these are soft restraints. It can be used. It needs to be ordered by a nurse or a doctor. A nurse have up to 1 hour to keep a restraint on a patient statewide, and the doctor could decide to keep it on further. But this is how you use the restraint. So when you come practice your skills, this is exactly what you do.